Good afternoon, everyone. My name is Lorraine Regan, and I'm with the Boom Group, and I'm here to welcome you to our lunchtime learning session. This is the fourth one in our series, and it's one that we're doing over because we had some technology issues the previous time when we tried to do it. So today's topic is on managing your mental health in a crisis. Delighted to welcome April. Dydra is a registered provisional psychologist with Synthesis Psychology, and it's a Calgary-based organization offering mental health and support to clients throughout Alberta. April herself specializes in supporting and helping clients grow through times of change and transition, which we are clearly going through right now. And she's here to talk about looking at how to look after our mental health and the mental health of others around us in a crisis situation. So a great big welcome to you, April. Thank you for joining us today.
Yeah, thanks for having me, Lorraine.
So why don't we get right into it? The first question I want to ask you is, can you define for us, please, what is a crisis or a crisis situation?
Yeah, and this is sometimes a difficult description to provide because there is a different approach and therefore definition of what a crisis is considered to be. So from a mental health perspective, crisis actually doesn't necessarily need to reference or refer to a specific situation, but it's really actually characterized and said by a person's reaction to a given situation or event. And so whereas one person might be significantly affected by a situation, another person might experience few or no challenges or changes in their life at all. So if we think of the current situation regarding COVID, it has been deemed a crisis for the most part and for most people because of the dramatic effects it's had on our lives and the unique reactions many of us have experienced both personally and professionally as a result.
Well, so many of us are in different situations. Some people have the ability to switch to, for example, a home office without any interruptions or issues, whereas others are switching to working from home while trying to educate their children while the schools have been closed. Still others have busy households and it's hard to find a quiet place to focus on work. And some people need to still keep going to work. So it is different for everybody, isn't it? Yeah.
Very much circumstantial. Exactly right. Yeah.
So how does a crisis situation typically impact a person's mental health?
Yeah, and just as much as our definition of crisis varies, this does too in some ways. So again, very different depending on the person. When we think about it in the context of COVID, it's not that everyone is experiencing a mental health crisis as a result of this pandemic, but a lot of people's mental health has, of course, been impacted. So a recent survey released by the American Psychological Association found that about 70% of people have indicated COVID has impacted their mental health at least some of the time. And we know that right now about 1 in 5 people are finding it's had a serious impact on their mental health, meaning that the symptoms or reactions to this crisis situation are negatively impacting them most or all of the time. So a vast majority of the population certainly has felt the impacts of COVID on their mental health.
So understanding everybody's going to react differently depending on the personality and the situation that they're in, but what are some of the common reactions you're seeing people have to this crisis situation in particular?
So in particular to COVID, and I think most crisis situations actually for that matter, is there's a lot of uncertainty about the future. And so we know that this naturally creates nervousness for people and can certainly lead to anxiety too as a more extreme symptom. And because life feels like it's a bit on pause right now because of the crisis, we're also finding people struggling with motivation. And this can easily dip into depression for some people. And then, of course, because the realities of our living situations and work situations, as you mentioned, have changed quite dramatically as well, we're seeing a lot of concerns related to relationships and employment too. So the reality is that crisis situations, especially those that last as long as they do in this situation, end up manifesting in a lot of different ways for different people. And what's often most helpful is being able to identify what our own common reactions are. And so when we're talking about some of these more common or mild reactions to crisis situations, a general rule of thumb is that we're typically more aware of changes in our own bodies personally. So this could be anything from a headache to fatigue or exhaustion, whereas we're much more in tune to changes in behaviors among other people. So this could be fluctuations in physical activity, performance at work, those sorts of things. So being able to recognize these reactions, which are essentially our body's way of alerting us that something's wrong or needs attention, makes it easier to manage those symptoms as a result.
And so that leads right into, the next question, which is, what are some of the things that we can do? When I look at, my mom would have said, you should go for a walk, Lorene, get outside, get some fresh air. But simple things like that really can shift your mental health a little bit, at least for a while. But what are some of the things that you think people can be doing to help protect their mental health or the mental health of others near them during a crisis situation?
Yeah, and your mom's actually not very far off there, because once you've recognized a reaction to stress or crisis, the next thing, of course, is being able to find a way to address that response and ideally mediate the situation as best as we can. So the most important piece of advice I have for people is to focus on what you can control in these situations. So the reality is that in many crisis situations, there's a lot of things beyond our immediate control, and that can often be a source of stress for people in itself. But with that said, there are typically a number of things that we can control. So one thing I like to recommend people do is make sure that they consume information from accurate sources. So for example, the Public Health Agency of Canada for people who are within the country versus social media. Another thing to consider is that while we can't be certain what the outcome of a crisis will be, we can certainly anticipate likely outcomes and make plans for these. So anticipating and preparing for the future by supporting your own safety during these times can be a helpful way to minimize uncertainty about the future. And then you mentioned helping others. So I can't emphasize enough how simple but critical and important it can be to help people with practical needs. So oftentimes during a crisis situation, so much of our energy, either mentally or physically, is consumed by crisis management. And so even essential tasks can become really overwhelming for some people. So everyday things like delivering food, mowing somebody's lawn, or whatever it might be, can easily take a really immediate burden off of that person. So one caveat to this, though, is that if you tell someone to let you know if they need anything, it's not likely you're going to hear from them. Again, because they just don't have the mental energy to consider that request. But instead, I encourage people to find out about the situations of people in their lives and make offers for support to do something really practical for them. So phrasing it like, can I bring your groceries later? Or what help do you need with your kids right now? Are much more concrete and therefore much more likely to be accepted.
And sometimes really it's reaching out to people and having a simple conversation with them. How are you doing? Did you see this? Did you see that? Or, can't wait to see you when we're able to get together again next time, but staying connected with them and making sure they know that there's somebody else out there aside from them.
It's a great point, yeah.
Yeah. Just thinking from our employer's perspective, for our member companies, what are some things that employers can be doing to help with their employees' mental health, or to check in or provide, information to them? What are some things you're seeing that employers are doing to help with that?
You've said it yourself here, Lorene, where you mentioned just checking in. It's one of the things that often gets overlooked is maintaining the mental health of our staff. And sometimes it's just as simple as making yourself available. Now, we have this open door policy that we often rely on, and unfortunately that's just too passive right now of an approach to take. So checking in with your staff, making yourself available for informal meetings. Something we like to do at our office is virtual coffees. So we'll set up a 15-minute meeting and we'll do a virtual coffee with a staff member. And it's really in an active way opening the door to that conversation. The one thing that employers are often relieved to hear is that our staff don't expect us to have the answer for them, but they at least expect us to be there for them. And if that's all you can do, sometimes that's enough.
Thank you. So what are some of the things that you can't do in a crisis situation?
And again, there's a lot of answers to this one too, but I'm going to go back to that concept of control a little bit, because one thing that we can't do is control and influence what isn't known yet. So for example, with COVID, the endpoint of this crisis, it's important to know that while worrying about these sorts of things is human, it's ultimately going to drain your energy and could lead to feelings of helplessness or hopelessness if you ruminate on it for too long. So something I often do with my clients is set a 2-minute rumination rule where they can let their mind run wild, worrying and wondering about absolutely anything and everything, and then bringing it back to the present moment after that time is up. It's something we sometimes refer to in psychology as counter-arousal, because what it allows us to do is interrupt what could otherwise be a cyclical or spiraling thinking pattern while still giving ourselves permission to worry, because that's just human nature sometimes. And the next thing that I think is important to mention here is we can't decide other people's reactions to a crisis situation. And it's something I talk about a lot with clients, especially now as we're unraveling and rolling out reopening plans. We're noticing people are having really different opinions about how this is being approached. So what I always encourage people to do, especially in crisis situations, is make your bubble smaller. In other words, focus as much of your attention and energy on what you can and do influence, because it's so easy to become preoccupied and overly concerned with how other people are handling a crisis situation. And especially when everyone is talking about what's going on right now on social media, it can really be quickly overwhelming. So make your bubble smaller.
Right, that's wise. The social media component too can be incredibly noisy and often very negative and scary if you're spending too much time in that social media realm and relying on it for the information versus, as you said at the beginning of this interview, going to those expert resources for that. And you're right, when you look at your bubble, whatever your bubble size is, it's a bit different for everybody. As it is starting to grow, you are starting to get a sense of some people are reacting like, oh good, this is fine, we're ready to go. Other people are like, whoa, I'm not ready. So really making sure that you're behaving according to what you're most comfortable with, and keeping it that way, not feeling the pressure to get out too early if the timing's not right, etc. Being open. I think another thing is if you have a situation where you're not comfortable, I think we need to learn how to express that as well in a nice, positive way. Like, is this safe? Can I do this? And, feel welcome to share those concerns with the appropriate folks that are around you. So there's lots of resources and tools out there, but what are some of the resources and tools that people might want to think about accessing during this time to help them move through it?
Yeah, and I think this is a great continuation to the conversation we're having right now, Lorraine, is that everyone's talking about COVID and everyone's sharing information about crises when they do occur. And it can be really difficult to know how to determine what is accurate. And so a good rule of thumb here is to look to the resources or tools that existed before this started. So your government and your community agencies are a great place to start. So for people who live in Calgary or surrounding areas, for me personally, Alberta Health Services and a lot of other government ministries in Canada and the US have an entire online resource list for crisis situations, and many that are specific to COVID. And then of course your helping professionals are trained to manage these types of situations. So psychologists and therapists such as ourselves are constantly staying up to date on changing circumstances, and many are offering distance and emergency support options during this time as well. So at the end of the day, as much as we want to be able to help ourselves and others during crisis situations, it's important, of course, to know our own limits and having realistic expectations for what we can take on, and to not hesitate to reach out, because we all need to do that from time to time. So again, sticking to the tools that existed before all of this started is a really good place to begin.
Thank you. And to your point, we all need help sometimes, and there is no shame or embarrassment in wanting to reach out to the appropriate resources to get that help. And there are a lot of resources available to people, whether it be through their employer or through government agencies, etc. And so we do encourage people to please keep those in mind, reach out, don't wait till it becomes a severe crisis versus a crisis situation before talking to somebody about it. And I think something that we all have in common right now is that uncertainty of what's going to happen next and where we've been over the last couple months, and not being able to be near loved ones, not being able to help our loved ones, seniors being locked down in senior centers. And, there's so many things that people are going through that are unique to each of them. So now more than ever is the time to not be fearful of reaching out for help from the appropriate sources when you need it.
Yes, it's probably the one beautiful thing about this experience is we're all sharing it together. So there's certainly or hopefully no shame in that reality.
True. Thank you. Now, if there was anything else you wanted to say that you want to leave the audience with respect to managing in a crisis, what would you say to them?
I think probably the one take home for me especially is that the reactions we experience, the mental health symptoms we have in response to a crisis situation is really just the way our bodies have been designed to warn us that something is wrong. And so to treat it like a normal, a healthy, and actually a helpful reaction to be experiencing stress or anxiety or depression or a lack of motivation during this time. It's normal, and yeah, in fact, it's actually quite helpful to experience those symptoms. So tune into them, let your body tell you what it needs, and allow that to guide you in the direction you need to go.
April, thank you so very much for taking the time out of your day to share with us these insights and ideas and ways to cope with crisis as all of us are going through it. Thank you. We will include some of the resources you talked about in this post so that people can share them with somebody they think needs help or they themselves can utilize them. For those of you who tuned in, this is April Dydra. She's with a registered provisional psychologist with Synthesis Psychology in Calgary, but they work with clients all over Alberta. And we're also going to share April's information on this post. So should you want to reach out and have further discussion with her, you can do that. So a big thank you. Again, my name is Lorene Regan with the Boom Group, and this was the 4th in our Lunchtime Learning series. We have more coming up, so watch for those on Facebook and Instagram. And thank you again for taking the time to watch, and thank you, April, for taking the time to share your insights.
Of course. Thank you so much, Lorene.